So we're going to do the anterior and the posterior load and shift tests. I've got my patient seated and I'm going to sit next to her because this is the easiest way for me to do these tests. I'm going to use my left forearm to block the scapula, palpating her coracoid process with my ring finger, and the superior part of the the humeral head with my middle and my index fingers. I'm going to come as close to the joint line, the humeral head, as possible with my other hand using my thenar eminence, and I'm going to produce a anterior shift, and then using the pads of my fingers, a posterior shift or glide. With these tests, you want to make sure that you are noting if the humeral head is starting in a position like, say, more anterior, more posterior, because that's going to affect the amount of translation. With anterior shift, you should be getting about 7 millimeters of translation. With the posterior, you should be getting about 9 millimeters of translation. And for the positive test for these, you're looking for pain, apprehension, a click, or just excessive translation. So for the anterior glide, you're going to be looking at the anterior glenohumeral ligaments and the anterior capsule. And then for the posterior glide, the opposite is going to be those posterior capsule and posterior glenohumeral ligaments.